Nation's top health officials warning that the Zika virus appears to be a lot scarier than first thought.
The World Health Organization declaring a global health emergency. And here in the U.S., with at least 50 cases now confirmed, there is mounting concern.
Zika. It's a virus that sounds almost distant, yet its reach has been global. It spread through the bite of Aedes mosquitoes, the same ones that spread dengue and yellow fever. But the Zika virus has one particular devastating difference, and that's its ability to impact unborn children. Zika can also spread through sexual contact, and crucially, from a pregnant person to their fetus. This can lead to birth defects like microcephaly, where a baby's brain doesn't develop properly, and other serious congenital conditions occur like vision and hearing impairment. In short, this isn't just a virus, it's a global health concern. The Zika virus was first identified in 1947 when British scientists working at the Yellow Fever Research Laboratory in Uganda's Zika forest isolated it from the Sentinel rhesus monkey. The virus, transmitted primarily through Aedes mosquitoes, was named after this forest. Interestingly, the rhesus macaque, the Asian species placed in an African forest, raises a question of whether the virus rapidly adapted from an African to an Asian host. However, not enough is known about the role of cross-species adaptation, particularly in an increasing virus pathogenic society. The first human infection was documented in Nigeria in 1954, but for the next 50 years, only around a dozen human cases were reported. It wasn't until 2007 that the Zika virus began to attract global attention, with the outbreak affecting 3/4 of the population on Yap Island in the Pacific. This was followed by a major outbreak in French Polynesia in 2013. Initially confined to these regions within Africa and Asia, the virus began to spread more widely in 2014, reaching Oceania and eventually South America. By 2015, millions of people across Brazil, Colombia, Venezuela, and 25 other countries in the Americas were infected. Although Zika virus infections generally cause mild symptoms including fever, rash, joint pain, and conjunctivitis, more serious complications have been reported. In pregnant women, the virus can cause fetal neurological conditions including brain damage and microcephaly. In adults, Zika has been linked to neurological conditions such as Guillain-Barré syndrome, while mosquito transmission, once believed to be the sole root of the infection. The discovery of the virus in the semen of a Texas patient pointed to the possibility of sexual transmission, which has since been confirmed. In early 2015, Brazil started noticing an increase in patients presenting with Zika symptoms, but the real shock came when a surge of microcephaly cases followed. Between 2015 and 2016, more than 1.5 million Brazilians were infected, and thousands of babies were born with congenital Zika syndrome. The country, already dealing with complex healthcare challenges, was suddenly faced with a public health crisis. The outbreak didn't stop at Brazil's borders. The virus spread rapidly across Latin America and the Caribbean. By mid-2016, 84 countries and territories had reported Zika. The spread was facilitated by international travel and urban environments where mosquitoes thrived, and limited immunity in these populations only sought more cases. By the time the World Health Organization declared Zika a public health emergency in February of 2016, the virus had reached the United States, with the first confirmed local transmission in Miami, Florida. Zika became a symbol of how quickly diseases can spread in a globalized world, affecting both developing and developed nations alike. The Zika outbreak didn't just cause a public health crisis, it triggered a global travel crisis as well. With Zika spreading across the Americas, public health organizations like the CDC and the WHO issued travel advisories, particularly for pregnant women or those planning to become pregnant. Airlines began offering refunds and cancellations for trips to Zika-affected areas. Major sporting events, including the 2016 Rio Olympics, faced heightened scrutiny and fear. For many travelers, Zika was the first disease that they had encountered where the risks weren't just personal but generational. A mosquito bite that could impact your unborn child, leading to serious birth defects, held a stark reminder that the interconnectivity of our world also extends beyond economics or culture, but it also means the diseases that spread faster than ever before. The Zika outbreak of 2015 and 2016 forced the global health community to rethink how we respond to the emerging epidemics, with several key lessons emerging. Rapid detection and response, particularly early detection of the Zika virus, could have mitigated its spread, but the virus was initially underestimated. By the time Brazil recognized a link between Zika and microcephaly, it already spiraled into a regional and global crisis. This highlighted the importance of international cooperation and information sharing. Mosquito control, particularly for the Aedes mosquitoes, thrive in urban settings where stagnant water is abundant. As more of the world urbanizes, controlling mosquito populations becomes more crucial. The Zika outbreak demonstrated the difficulty of eradicating these mosquitoes in densely populated areas and pointed to the need for more innovative solutions in vector control. The long-term impact of viral infections. Unlike some other viral infections that primarily affect those who are infected, Zika's most devastating effects were felt by the next generation. The association between Zika and birth defects changed public health officials' approach to the outbreak and redefined the need for comprehensive pre- and postnatal healthcare support. In response to the Zika outbreak, the World Health Organization declared a public health emergency of international concern back in 2016. Governments, especially in affected regions, ramped up mosquito control measures, and scientists escalated their research into vaccines and treatments. Efforts to combat Zika were multifaceted, involving healthcare, education, and outreach. Today, Zika is no longer dominating headlines, but the virus is still a present threat in many parts of the world. Vaccine development has shown promise that remains in progress, and vector control continues to be a critical area of focus. We are now better prepared to handle outbreaks, but Zika's legacy remains, and it remains a reminder of how a virus carried by mosquitoes can change the course of public health. The Zika outbreak might be behind us, but it's left a lasting impact on global health. It has forced us to rethink how diseases spread in a hyper-connected world. It reminds us of how we need to remain vigilant and proactive and prepared for the unexpected. The next pandemic might be different, but the Zika virus has given us a blueprint of how to respond swiftly and decisively, with a focus on protecting the most vulnerable among us. Zika was a wake-up call for the world. A small virus carried by a small insect traveled across the globe and changed the way we approach public health. Its legacy isn't just in the babies born with microcephaly, but in the lessons we've learned about how diseases spread, the importance of global coordination and vulnerability of our interconnected world. This virus may have emerged from a small forest in Uganda, but its impact has been felt everywhere. Thanks so much for joining. Like for likes and dislikes for dislikes, and please subscribe for more.